Bismillahirrahmanirrahim. Welcome back, friends. Welcome to another video lecture by Kami Biology. So in this video lecture we are going to talk about the diagnosis of the chikungunya disease. Diagnosis. In the previous video lecture, if you guys remember, we talked the signs and symptoms, treatment, prevention, epidemiology, introduction, and some other transmission, genome, structure of means this chikungunya disease. In this video lecture we are going to talk about diagnosis of the chikungunya. Now there is no proper diagnosis for the chikungunya. So usually we can identify the chikungunya disease by the signs and symptoms. So it should be diagnosed by sign and symptoms. 15 to 85% says 15 to 85% people says that if we have joint pain, so it may identify the chikungunya disease, and almost 40 to 50% people says that if these rashes appear on the trunk area and on the face area, so it may also identify, or it may also diagnose the chikungunya disease. Okay, then we have some in Pakistan usually this chikungunya disease are identified by the PCR, and usually in Pakistan two types of the PCR are performed for the chikungunya disease. The one we call it real-time PCR, and the second we call that real-time loop-mediated isothermal amplification. So these two are the type of PCR due to which we can amplify the genome of the this arboviruses, and we make sure that this is the chikungunya disease. Moreover, this chikungunya disease are also identified or diagnosed by the ELISA and chromatography. Because each test are usually performed for the antibody titers. Culturing mosquito cells which take 1 week almost. Okay, after 3 to 5 days of the infection, we take the blood sample and we centrifuge it, and then we take the serum portion, and then we treat this serum portion with anti-chikungunya 3 grams. 3 grams of anti-chikungunya drugs, and in this case the anti-chikungunya drugs are actually IgGs. So we use IgG antibodies which are commercially available. We allow this IgG antibody and blood serum, and after sometimes we check the agglutination, which can shows the signs and symptoms of the chikungunya disease. Okay, so that's how we can diagnose the chikungunya disease.